Facial paralysis is a side effect of many health issues, and it can linger long after the initial cause. But now, through facial reanimation surgery, patients are getting their smiles back thanks to Orlando Health. Joining us now to discuss is Dr. Jurij Kiefer from the Orlando Health Aesthetic and Reconstructive Surgery Institute. Thanks for being here.
Thanks for having me.
A lot of people probably know about facial paralysis after a stroke or from Bell's palsy. What else can cause this?
That's right. It's the most common cranial nerve lesion that we have, and mainly associated with Bell's palsy, a idiopathic cause. But it can also be due to a traumatic injury or cancer-related treatment, or even due to the cancer itself. The facial nerve travels through the back of our skull into our parotid gland, and therefore is exposed to different cancers within the skull of the base as well as on the parotid gland itself.
You are actually one of a handful of people in this country who specialize in something called facial reanimation surgery. This blows my mind. You can actually transplant nerves and muscles to help people be able to accurately express their emotions again. How does this work?
Nowadays, we are fortunate to have all kinds of tools that help us to identify small nerves and reconnect them. In most cases, we can give the existing muscles a new motor, meaning a new nerve, which we borrow from other parts of their body, from the other side of the face, or from other cranial nerves. By doing this, we can, in most cases, re-innovate the existing muscles. If, however, they come later because they never heard of it or never heard of the options there are out there to treat facial palsy, we can, as you mentioned, transplant muscles from basically the thigh to the mid-face to enable the patient to smile again or to be able to blink their eye again.
You're just doing such incredible work and changing lives out there. I'm sure you have some success stories that just really touch your heart.
That's very true. It's a very humbling experience to help those patients in all forms and sorts of their life, whether it's a kid that finally smiles or it's an elderly patient who is suffering from their previous condition and now is just happy to be able to drink their tea without any problems anymore, or to sleep without any patches on their eyes. The stories are numerous, and I'm very grateful that we can now offer this service line at Orlando Health.
And if you would like more information, you can visit orlandohealth.com/facial-reanimation.